Medicare likely overpaid in the hundreds of millions. 2 CNAs suing a nursing home for discrimination. 3 of now 5 CNAs from the same facility arrested for sexual relationships with residents. Nebraska takes control of companies' nursing homes. Louisiana wants to shift support to home health. And drug prices for seniors goes way up. This and more next.
You're watching LTC News with Dane Henning.
Welcome to CNA TV Long-Term Care News. I'm Dane Henning, and today is Friday, March 30th, 2018. A federal review of outpatient physical therapy payments found Medicare likely overpaid $367 million during a 6-month period. The Department of Health and Human Services Office of Inspector General examined a random sample of 300 claims and found 61% did not meet the medical necessity, coding, or documentation requirements. The OIG issued its report last Friday, projecting that the same rate of improper payments that led to $12,741 in improper reimbursement over a 6-month period would equate to $367 million system-wide. The OIG said that only 116 of 300 examined claims were properly filed. McKnight's Long-Term Care News reporting. 2 certified nursing assistants have sued Century Care of Laurinburg in North Carolina, which operates as Scottish Pines Rehabilitation and Nursing Center, for failing to make workplace accommodations available to them under the Pregnancy Discrimination Act, an amendment to the Title VII of the Civil Rights Act of 1964. The lawsuit has been filed by the Equal Employment Opportunity Commission for the incidents that occurred in 2014 and 2015. The lawsuit alleges that Scottish Pines offered light duty or job accommodations and temporary restrictions for CNAs who were injured at work but did not modify the job requirements for the 2 women who became pregnant while working for the company. The EEOC's lawsuit claims that the company had mechanical devices such as a Hoyer lift to aid in moving patients from bed to a chair and, quote, did not prohibit CNAs from seeking assistance from coworkers to manually lift patients. The EEOC contends that the company could have accommodated the restrictions. The EEOC also attempted to reach a settlement for the 2 women, but then filed the lawsuit with the U.S. District Court for the Middle District of North Carolina. The EEOC is suing for back pay, compensation, and punitive damages, including policy changes at the company for the 2 women. The Laurinburg Exchange reporting. 3 women who were certified nursing assistants at Prairie View Residential Care in Fayette, Iowa, are accused of having sex with patients. An investigation found that 3 women were discharged from the Center for the Relations, and they were arrested on March 23rd. The arrest came after an investigation following 2 other certified nursing assistants arrested on March 5th for sexual exploitation while being employed at Prairie View. Carolyn Wydrick, 44, of Sumner, was found to have sexual relations with a patient when employed in 2015. The investigation also found in 2016 Shelby Sebring, 24, of Hawkeye, and Jamie Pagel, 32, of Sumner, had sexual relationships with patients during their employment as well. During the time of the crimes, all patients were court-ordered for treatment. The 3 women later bonded out of Fayette County Jail on a $10,000 bond. If convicted, they could each face 5 years in prison and be required to register on the Sex Offender Registry. KCRG TV reporting. We'll be back right after this break.
From the Heart, a weekly segment with John Willard, airs every Tuesday at 2:30 Central Time on CNA TV.
The state of Nebraska has taken control of 21 nursing homes around the state due to an inability for the owner to make payroll. The owner of Cottonwood Healthcare, also known as Skyline, notified the state about its financial crisis. The state then took action. A Lancaster County judge approved a plan last Friday to put the homes in receivership and under the management of Kleismeyer and Associates, while a plan for the home's future was prepared. State officials also are working to ensure that the residents of the facilities are receiving proper care. Associated Press reporting. A group of Louisiana legislators want to change the way the state provides care for its elderly and disabled residents by shifting funding and other support away from nursing homes and toward in-home services. Lawmakers say that the state system is heavily biased toward nursing homes, which received 77% of the state's Medicaid budget. That leaves just 23% of home-based programs, while other states have a split closer to 60-40. Legislators filed 3 bills this session targeting funding changes and potential savings of $200 million, while another allows surveillance devices in nursing homes so families can monitor care. All 4 bills were scheduled for a hearing last Tuesday. McKnight's Long-Term Care News reporting. In a new report released by Senator Claire McCaskill, the Democrat from Missouri, researchers found that the most widely prescribed brand name drugs for seniors experienced sharp price increases over the past 5 years, even as prescriptions declined. The report said that prescriptions for top-selling drugs like Advair, Crestor, Lyrica, and Nexium dropped by $48 million, but the revenue increased by $8.5 billion from 2012 to 2017. At the request of McCaskill, minority staff of the U.S. Senate Committee on Homeland Security and Government Affairs compiled the report, which reviews overall price increases amongst the top 20 most commonly prescribed brand name drugs for seniors. The increased spending is also trickling down to Medicare beneficiaries. The report said, quote, according to one independent study, Medicare beneficiaries' out-of-pocket spending on prescription drugs is expected to increase from 41% of per capita Social Security income in 2013 to 50% in 2030. Provider Magazine reporting. Now for In the Headlines from McKnight's Long-Term Care News. Still no word on whether CMS will approve lifetime Medicaid limits. Lawmakers and reporters alike have been unable to pin down Centers for Medicare and Medicaid Services Administrator Seema Verma on her agency's view on states' requests to impose lifetime coverage limits on Medicaid beneficiaries. Some say the proposals would hit aging Americans especially hard. Verma told a media briefing in Washington, D.C. on Thursday of last week that to obtain CMS approval, the request must, quote, meet the objectives of the Medicaid program. Providers laud withdrawal of Bill of Rights for nursing home residents. A proposed Bill of Rights for residents of nursing homes and assisted living facilities was withdrawn from consideration before a Florida Constitutional Revision Commission, a move drawing praise from industry advocates. It was a measure that had captured the attention of long-term care professionals nationwide. Proponents said Proposal 88 would have ensured residents were treated, quote, courteously, fairly, and with dignity. But opponents argued that the bill would have been nothing but a tool for costly litigation. This has been your Long-Term Care News Update. Everyone have a wonderful weekend, and I'll see you next week.